In this video, I'm going to be demonstrating the Lachmans Test. The purpose of this test is to test the integrity of the ACL, the anterior cruciate ligament, for any sagittal instability in the knee, where a positive test could indicate an ACL injury. So for the Lachmans test, we want our patient lying supine. First, we're going to be flexing their knee to about 20 to 30 degrees. And to do that, I like to place my knee just underneath their knee to help them get into that position there. Then you're gonna place your hands just below their knee joint line, and your thumb can go right on the tibial tuberosity. I also like to stabilize the thigh with my other hand, so we're just going to be doing an anterior translation force on the tibia for several seconds, like so. A positive test would be an anterior translation of the tibia greater than 2 millimeters in comparison to the unaffected knee. All right, so that was the Lachmans test. If you'd like to see how we can assess the integrity of the PCL, you can click on this video here. Don't forget to hit the like and subscribe button if you enjoyed the content, and I'll see you in the next video.